Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
In our opinion, of course,
We're
Bob.
going to show you some ways to mobilize your hips. And when you do that, you're working deeply on the connective tissue.
Right.
And maybe the capsule of the hip. You're really trying to get it in there. So you should follow 3 rules. The first one, you can go along the fibers.
That's not your hip, Bob.
Well, it's coming from my hip. Or you
I'm
can
just
go
kidding.
across the fibers.
Right.
We like it both ways.
Sure.
You should stay on the tissue until it changes. In other words, if it's tender, you want to see it reduce a bit, the
Right.
tenderness. And the final thing is you want to try different tools to see which one works best for you.
Right. We've got some things that you may have laying around the house and some other
Right.
things that you may, have to purchase or you may already
Tennis
have.
ball, lacrosse ball, softball,
Yes.
foam roller,
That's right.
booty stick.
Yep.
You can just roll right along here. You got massage sticks.
Yeah.
So?
All these little gadgets, you'll see them on the internet.
Bob Brad massage gun.
yeah.
Works really good.
It doesn't have to be ours. It can
Yeah.
be any massage gun, actually.
Right.
But we do know ours are good.
So Brad's going to first kind of do a routine with the foam roller where he's going to hit the hip flexors,
That's
hip
right.
adductors.
Yeah, and you're not going to do this on a bed with the
No.
foam roller. You need to go on a floor. A carpeted floor is the best, but either way will work. I've done it both ways. We're going to get this. I always say where you put your hand in your pocket, that's about where we're going to get into that hip flexor. That's the muscle that pulls your knee up to your chest.
And you can go right down into the quad because the quad's going to greatly affect the hip,
yeah.
especially the rectus femoris, which attaches up in there.
Yeah, and I'm going to roll over this way. You'll feel, because I can feel, the tight spot in there.
This is definitely one I do every morning, Brad, because
Yeah.
I have trouble with this muscle.
You got to be careful, though.
Yeah.
Now I'm going to go up because there is one
Yeah.
femoral muscle that does cross the hip, does a little hip flexor. What's that one again?
Rectus femoris.
Oh, that's right. You mentioned that already. Yeah, so I'm going to work
Rectum
that.
damn near killed him.
Yeah. Then I'm going
Now
to.
you can actually, when you're doing that, Brad, you
Yep.
can flex the knee and extend the knee. You know what I'm
Oh,
talking
yeah,
about?
so here
a
we're
little bit
gonna-
of
yeah.
flossing, like if you go down
Yeah.
a little bit further, and then yep,
And,
that's
yeah.
if you want to get a little more technical.
Yeah.
you can do that.
Yep. I'm going to. Can I go to my hip adductor?
Yes, why don't you? That's a little more tougher
Yeah.
to do, isn't it?
I like to put my foot right there, and my elbow is supporting and actually limiting how much
you're
pressure.
getting the IT band too if you go further
Sure.
down. Now, the IT band is a really thick band, and you're not going to stretch that per se, but it heats down, like it's glued down. So this does help that, and it really makes a big difference with people who are having trouble with it.
There we go,
The
Bob.
one I had trouble with, Brad, is the hip adductor. I don't do this one, to be honest with you.
You mean up here?
The hip adductor.
Oh, the adductor.
Yeah, I actually use a massage gun on it.
Yeah, I don't even know how you.
Yeah.
You can try to.
You can try it.
This is about the best you can do. You cannot get a lot of pressure, but it does work on it. So try it out and see how you respond to it.
Right.
I'm with Bob, though I don't
Yeah.
use it for that.
That's pretty much it, Brad, right there. But
Wait, I thought there was one more, Bob.
well, the IT band, which we did already.
What about my glute?
Oh yeah, you did do your glutes,
Yeah.
didn't you?
So I'm going to work that glute max, and you get in that piriformis. And I do like this, and to get around the SI joint. It's fun. This is really one of those things that you enjoy doing because it feels good.
The foam roller is nice because it's fast, and sometimes you can get both sides at the same time.
Yep.
The massage gun works better. I
less
do a lot,
effort.
yeah, less effort, but it takes longer because you're hitting kind of a smaller spot.
But it does get deeper,
Yeah,
especially if you're working that glute max in this area.
yeah. If you want to get to hip adductors, this is a great way to do it. Mine are always sore. They're right now.
Yeah, Bob, you got to be careful. You're getting too active at home. I can tell you that. Even these smaller ones. I've had people. I got one guy. He had a stroke actually in hip replacement. He's doing really well, and he likes this one because he can
Right, you can
grab
really
it a
grab
little
onto
better,
it.
and it still gets pretty darn deep.
Sure.
I just wanted to. The
You just
SI
want to do
joint
it.
is really good for me there.
SI problems. So
Are we
thanks for
done?
watching. Yeah, that's
Oh,
it.
good.